Okay, guys. Today's discussion A explains a death doula. Okay, so give me a few minutes to set up for the show, and I'll be right with you. Okay. Title of the article is "I'm a Death Doula." Okay, it explains what a death doula, what her duties are as a end of life person. So here we go. I'm going to explain it to you now. Title: I'm a death doula. Here's what I've learned about end of life is a deeply personal reflection by Lisa uh, Kanarak, who shares her journey into becoming a death doula, a non-medical professional who supports individuals and their families during the final stages of life. Okay, here we go. Key themes and insights. Personal catalysts. Lisa's experience caring for her father during home hospice sparked her desire to better understand death and provide support to others. The emotional weight of administering morphine and witnessing his final moments left her feeling hopeless and unprepared, which later motivated her to pursue doula training. Okay, now we're going to go through the role of a death doula. She spends time with hospice patients in their last days or hours, offering emotional support, uh, presence, and guidance, contrary to assumptions that uh, this work is depressing. Lisa finds it life affirming. Um, it heightens her awareness of mortality and inspires her to live more fully. Training and purpose. After her father's death, she enrolled in end of life doula course to gain the knowledge and confidence she wished she had. Her goal is to help others navigate death with dignity, understanding, and less fear. Emotional complexity. The article touches on the guilt and grief, missing her father's final breath, and how that Come on, folks. How that moment continues to shape her approach to caregiving and legacy work. Okay, then you got tone and message. The piece is both tender and empowering. It reframes death not as a clinical event, but as a sacred transition, deserving of compassion and presence and preparation. Lisa's story underscores the importance of emotional literacy and community support at end of life. If you're curious, I'd love to explore how this interacts with your work on memory friendly design or frailty assessments, especially in how we prepare environments and caregivers for these final transitions. Death doulas are quietly reshaping how society approaches death, offering more compassionate, personalized, and holistic experience during life's final chapter. Their roles span emotional, spiritual, logistical, and educational domains, often bridging gaps left by traditional healthcare systems. Core societal roles of death doulas: emotional and spiritual support. They provide a calming presence for the dying and their families, helping process fear, grief, and emotional questions, external questions. Legacy and life review facilitation. Doulas help individuals reflect on their lives, record stories, write letters, or create memory books, preserving meaning and a connection. End of life planning. They assist with advance directives, vigil planning, and funerals. Funeral arrangements and coordination with hospice and palliative care teams. Caregiver guidance and respites. Families often feel overwhelmed. Doulas offer practical advice, emotional support, and relief during intense caregiving periods. Bereavement follow up. Some continue supporting families after death, helping them navigate grief and adjust to loss. Public education and advocacy. Many host death cafes or community events to normalize conversations around dying, natural burial, and ethical death care. Why their role is growing. There's a rise there's a rising demand for patient-centered holistic care that honors personal values and cultural diversity. Death doulas are increasingly seen as complementary to hospice, fulfilling emotional and spiritual gaps that medical teams may not address. In places like Australia, there's even a push for national accreditation, signaling their growth their growing legitimacy in formal care systems. Given your work in memory friendly housing and frailty assessments, death doulas could be powerful allies in designing environments and care models that honor autonomy and emotional well-being at the end of life. Would you be interested in exploring how their practices might integrate integrate with smart elder care technologies or legacy building tools? Death doulas offer a kind of emotional support that deeply uh, attuned to psychological and external needs for both the dying and their loved ones, often filling a void left by clinical care models. Types of emotional support provided by death doulas: compassionate presence. They sit with the dying person, sometimes in silence, sometimes in conversation, offering a steady, non judgmental presence that helps ease fear and loneliness. Validation of emotions. Doulas normalize the wide range of feelings: anger, regret, peace, confusion that arises near death. They help individuals feel seen and heard without trying to fix or minimize their experience. Just one second, guys. Got to fix something. Be right with you. Hold on a second. Fascinating, facilitating difficult conversations. Whether it's saying goodbye, expressing forgiveness, or sharing final wishes, doulas guide families through emotionally charged dialogues that might otherwise be avoided, creating rituals and meaning. They help design personalized rituals, lighting candles, playing music, storytelling that bring comfort and honor the dying person's values and identity. Support for families. Doulas offer emotional coaching to caregivers, helping them manage anticipatory grief, guilt, and exhaustion. They may also provide bereavement support after death. Guys, they're like hospice care, but it's a little different. Legacy work, helping somebody, helping someone reflect on their life, record memories, or write letters to loved ones can be profoundly healing. It gives emotional closure and a sense of community. Why it matters. This kind of support isn't just comforting, it can reduce anxiety, improve quality of dying, or foster a deeper connection among family members. It's especially powerful in settings where cognitive decline or frailty complicates communication, making the doula's uh, intuitive and patient approach invaluable. Given your interest in memory friendly design and neurodegeneration, I wonder how these emotional practices might be adapted for individuals with dementia or brain injury. Would you like to explore that intersection? death, death doulas can be transformative uh, compassion companions for individuals with dementia, especially as cognitive decline complicates communication, emotional regulation, and end of life planning. Their their practices are unique, suited to meet these challenges with empathy and creativity and presence. Ways that doulas support individuals with dementia. Nonverbal, nonverbal emotional connection. As verbal abilities fade, doulas use gentle touch, soothing sounds, and sensory cues to create comfortable or comfort and connection. This can reduce aggression and foster a sense of safety, preserving identity and dignity. Doulas help maintain routines, honor personal preferences, and engage in, in life review. Even in even if fragmented, they they validate the person's story and worth, which is crucial when memory loss erodes self concept, facilitating joy and familiarity through music, storytelling, or familiar rituals. Doulas invoke positive emotions and memories. These moments of joy can be grounding and healing for both the individual and their caregivers. Supporting caregivers, doulas guide families through anticipatory grief, difficult decisions, and legacy building. They help caregivers process emotions and reduce stress, which improves the overall care environment, creating a peaceful transition. In advanced stages, doulas focus on comfort and presence, helping the hold on to change helping the person feel less alone and more at ease. Their calm demeanor can reduce fear and confusion during the dying process. Why it matters. For someone with dementia, the end of life journey can be disorientating and isolating. Death doulas offer a stabilizing force, one that prioritizes emotional reason, uh, reason over cognitive clarity. Their work complements memory friendly design and frailty informed care by adding a layer of human connection that often uh, that's often missing in clinical settings. Given your interest in neurodegeneration and memory friendly housing, we could explore how doulas practice might integrate be integrated with smart environments or therapeutic routines. Would you like to delve into that next? Death doulas hold on, use a wide range of practices to support individuals and their families through the dying process, many of which are deeply personal, sensory based, and emotionally uh, attuned. Their work is not their work is non-medical but profoundly holistic, often tailored to the unique needs of each person. Use a use a wide range of practices to support individuals and families through the dying process, many of which are deeply personal and sensory based and emotionally attuned with their work uh, is non uh, is non-medical but profoundly holistic when tailored to the unique needs of each person. Core practices of death doulas: creating a calm environment. They help design the physical space to reflect the dying person's preferences, adjusting lighting, sounds, scents, and even textures to promote peace and familiarity, facilitating open dialogue. Doulas engage honest conversation about death, fears, regrets, and final wishes. This can ease emotional burden and foster connection. Legacy and life review work. They guide individuals in reflecting on their lives, recording stories, writing letters, or creating memory books that preserve meaning and identity. Visual planning. Doulas help plan how the final hours will unfold, who will be present, what rituals will be performed, and how comfort will be maintained. Coordinating care teams. While non medical professionals, doulas often work alongside hospice and palliative care providers to ensure continuity, continuity and emotional support. Grief and bereavement support. Some doulas continue working with families after somebody passes, guys. After death, helping them process grief and adjust to life without their loved ones. Ritual creation, from candle lighting to music selection, doulas help craft personalized rituals that honor the dying person's values and beliefs. Advocacy and education. They often host community events, death cafes, to normalize conversations around dying and empower people to make informed choices. Philosophy behind their practices. Death doulas view dying as a shared transition, not just medical event. Their practices are rooted in presence and compassion, and the belief that emotional and spiritual care are just as vital as physical comfort. Considering your work in memory friendly housing and neurodegeneration, these practices could be powerful tools for enhancing dignity and emotional resilience in end of life care. Would you like to explore how these might be adapted for smart environments or integrated into caregiver training? Becoming a death doula involves specialized training that blends emotional uh, intelligence, practical caregiving, and end of life uh, literacy. There is no single path, but several uh, respected organizations offer comprehensive programs tailored to different learning styles and professional goals. Popular training options is like NIDA, National End of Life Doula Association. Hold on. Got to finish the rest of this. Offers foundational end of life doula training with no prerequisites. Includes 10 to 12 hours pre-work, 24-hour of live instruction, and 3 to 4 hours of paperwork or post work. Formats range from intensive in-person retreats to extended online sessions. Optional certification programs spans 1 year and includes uh, mentorship, cohort reviews, and continuing education. National End of Life Doula Certification Academy provides self-paced online certification with 27 modules and a 164-page guidebook. Okay, guys, so you could get certified online for this. If someone is interested in being one, there are education practices for this. So that is A for today. I'll be back on a little later after dinner for B and C. I will see everybody later for shows. For now, Gator Wellness. Take care, folks.